This is my ATTR 810 mid-semester reflection. I perceive my performance so far in this class, I would say, much better than my performance in classes in the fall. I know one of my goals at the end of the semester last semester was to be more engaged in the coursework and find that balance between clinical practice and engaging in the material. So I think I've done a pretty good job with that. I'm not sure if that's because of my decreased workload in terms of volleyball or just my motivation to learn some new things, but I am fully engaged in the content. I sit down with a reading every week, and I look for ways to take what we're reading in class, the podcast, things we're talking about with our groups, and try to find ways that I can implement it into my clinical practice. So what I think is going well in this course, I would say the flow of the course really makes sense to me. I really like how we talked about risk factors and the disablement model and sort of got a foundation for the rest of the class. I just appreciate that it sort of makes sense in my head. Also, I really like this week our group collaboration with the podcast in Infographic. I think I had some really great collaborations and conversations with people that I had not previously had much collaboration with, so I would appreciate if that happened a little bit more often. Whether it be a Blackboard Collaborate or a group discussion or something along those lines, I thought this week went really well. Things that I think are not going well, there's not many. I feel like I'm not applying the injury screening tools and the new evaluation techniques as quickly into my clinical practice as I should be, and that's probably a product of not being that confident with them yet, but that lends to the next question: how can I improve the second half of this course? I think for me, just asking my classmates and my peers downstairs and my peers at home to practice these new techniques, these new tools before I apply them to my patients. So getting comfortable, just like any skill we learned so far in our education, we practice it, we talk about it before we apply it to clinical practice. Like I haven't done a hip evaluation in probably over a month, simply because I have not had symptomatic hip patients in that long. So again, practicing with my and collaborating with my peers. How can my classmates improve the second half of the course? Honestly, I know that you, Dr. Games, have said multiple times, if you are not engaged in the coursework, then you're not going to get anything out of it, and I agree with that completely. I know that sometimes someone has a bad week or a really busy week for work or maybe another class, and maybe people put the readings that you assigned a little bit lower on their priority list than they should be. So if I could have one thing that my classmates could do better, it would probably be to really sit down, fully engage in the reading, and trust the process. Trust that, the risk factors are going to lend to the ankle and the ankle to the knee, and that the course kind of is how it is for a reason. How can the course be adjusted midstream to improve the second half? Like I said earlier, I really think that the interactions I had this week with my group members were arguably probably the best interactions that I've had so far in terms of group work. So I think rather than just, looking at what's assigned on Monday morning and sitting down with the articles in my little bubble and just doing the assignments by myself, which is fine, I think I get more out of the class if I not only sit down with the articles, understand it for myself, but then can also have a conversation about the material to my classmates, and then, come up with a podcast, come up with an infographic, have a discussion online about, are we implementing these things, rather than just sitting down with the content and reading it and then moving on. How can the instructor improve the course of the second half? I'm pretty content with the class so far. If there was one thing that I think could be changed, sometimes when I read through the assignments for the week, like the Prezi or some of the weekly tasks, at the bottom you'll say, make sure you have a DAT logo, or make sure you verbally say you're a member of the Indiana State University Doctorate of Athletic Training. And I can appreciate that you want to, and we want to, promote the program and recruit and, make this program great. And the only people that can do that are, us, and advocating for ourselves. But sometimes I feel like the assignments, the first or primary reason we're completing the assignment is for that reason. And the secondary reason we're completing that assignment is to demonstrate our understanding of the content. So I don't really know how that can change, but sometimes I just feel like I'm kind of doing this assignment so that we can promote the program, not I'm doing this assignment because I want to demonstrate to myself and to you that, look at my synthesis of the information and look what I learned this week. So with that, I think that's all, but again, that's just a small thing that I've noticed, and I'm enjoying the class so far.